in this time of COVID, if it's about screening for certain questions, if I need you to come into the office, I want to ask those questions before you get in your car, before you potentially expose yourself to anyone. Let's talk about your case, understand your needs.
Welcome to Startup Health TV. This is a COVID-19 health innovation update where we talk to health entrepreneurs about the work they're doing to fight the coronavirus pandemic. I'm Logan Plaster, editor of Startup Health magazine, and I'm here with Brant, Herman, CEO and founder of MouthWatch. So Brant, great to have you for a quick update today.
Yeah, thanks so much. Thanks for having me.
First question for each of these updates is, how are you, where are you working from, and how is this pandemic affecting you personally and in the business?
Yeah, so personally, we're in New Jersey. Our office is a couple of minute walk from our house, so we're able to kind of still come into the office. I'm in the office alone, and all my employees are working from home, and my kids are being homeschooled by their former teacher. I'm sorry, not that. That didn't come out clear. My wife, who is a former teacher, so she knows how to run a classroom. So she's
You're very fortunate.
Yeah, the new role of homeschool teacher. But yeah, I think there's a little anxiety, and for us, it's this fortuitous moment where what we've been building for a long time is really able to help out the industry we serve. So we've been busier than ever on the teledentistry side. So it's
interesting.
This, hectic combination of things.
Yeah. Okay. Well, let's dig into that. I mean, obviously, telemedicine is having its moment. Not as much talk from the national stage about the role that teledentistry plays in that. So kind of break that down for us.
Yeah, dental's always been the redheaded stepchild in a way of the healthcare world. Fine, we love that child. So teledentistry has always been a little bit different than telemedicine in that when providers and patients are using a telemedicine solution, while there's a lot of provider to provider solutions for it, you could get, good results with talking to a physician who's calling in a prescription via teledoc and, helping support you and answer any questions about it. Teledentistry, we were always about patients to providers for more efficient physical appointments where you could coordinate care delivery, you could get expertise to patients in mobile settings or rural settings, take the most expensive part of dental care delivery being the dentist and make them more efficient in them being to stay in a brick and mortar location, but send out affiliated staff, so hygienists, assistants, really do screenings and make it convenient access to care for patients. COVID-19 has totally changed the game on that. Full settings are no longer available. All practice closed. Many states, even emergencies aren't allowed in a dental office anymore. And that's probably more and more will head that way. But they're closed for elective procedures, for preventive care. So what teledentistry is doing, what we're doing with Teledent, really about allowing doctors to communicate with their patients while patients are under shelter-in-place orders to come into the office. So triaging emergencies, prescribing anything from antibiotics to painkillers to home care, pharmaceuticals, and then just communicating with patients about home care instructions, checking in on them following treatment that may have happened during their last visit, and really just being a resource to their patient base.
So for anybody who's not that familiar with your actual product, let's talk about how teledentistry actually works, because I think a lot of people would be thinking, how can this ever happen remotely? Someone's got to reach into my mouth. How does it work?
Yeah, we're not in the age of the robotic dentist yet. So what teledentistry allows is really the virtual consultation. So if you're being triaged, if you think you have an emergency, right, now there's a requirement that you're communicating that information to your dentist, not just over a phone, but you're sharing photographs that may have been taken with your cell phone camera. The location had an intraoral camera, they could get more into the oral cavity. But you're taking that information and sharing it to the dentist You're conducting a live video consult like what we're doing now. We're guiding dentists as to how to get a patient to show them the areas of concern. The quality of cameras and cell phone cameras is significant. So even though you're not maybe getting all the way into someone's mouth, you're able to see if there's inflammation, if you're seeing a lesion, if you're seeing swelling. You can then kind of chart your treatment recommendations based on that. So for us right now, teledentistry is this patient-facing approach where patients are invited to a portal that they can share messages, images, information, educational resources, all in real-time chat, in chat that becomes a notification if they're offline. And then a doctor can say to a patient, let's set up a video conference because I want to talk through things. If I'm going to prescribe any medication for you, I need to do it via real-time video. So that's kind of what teledentistry looks like now. We can do a whole bunch of other stuff with it, of adding in specialists. So if I need to have my oral surgeon on the call while my dentist is on the call with me, we can facilitate that. We can facilitate data sharing and collaboration about your case. So Logan, you're not on the call with us, but now your oral surgeon and your dentist are coordinating and talking about your treatment plan. And now we're going to present it to you so you know what to do. And in this time of COVID, if it's about screening for certain questions, if I need you to come into the office, I want to ask those questions before you get in your car, before you potentially expose yourself to anyone. Let's talk about your case, understand your needs, ask you the COVID screenings, and even give you an understanding of when you come to my office, this is how we're going to do it. The door will be open. Don't touch any surfaces. Park in the car. Call us when you get here. Walk in, don't sit in the waiting room. Go right into the operatory. We'll see you in the operatory. When you're done, just go. And then the next patient will be called in. So really minimizing contact, reducing risk to patients, assuring them, reassuring them, reducing anxiety, and just being a better communicator with the patient.
I really think this is great practical advice, because one of the themes over the last couple of weeks is this idea that in the midst of the pandemic, other health issues are not going to go away at all. And
Right.
so you're going to have someone with a horrible toothache, an abscess, a broken tooth, whatever it is. Tooth emergencies are awful. They're just some of the most painful things that you can have to deal with. And so the idea of what do I do, that practical advice. So you said I want to go back to one thing you said earlier, and that surprised me. I know you have your own intraoral camera that can be used by professionals, but you mentioned just the power of a smartphone. Are you saying that the future of teledentistry is in my phone's camera, just sticking it in my mouth for an initial triage?
Yeah, I think for most patients, we don't see a lot of, the number of patients who are going to invest that amount for a camera, and people who are buying, let's say, a $300 electric toothbrush is already a small group of really dedicated oral health enthusiasts.
Uh-huh.
But we don't expect a widespread purchase of the camera for patients now. We do think that for vulnerable populations, care settings where you have multiple patients. So right now, a nursing home is a great example. You can't send a dentist into a nursing home now, but you can send an intraoral camera in, so you can do thorough evaluations of patients with the dentist working remotely and really help them understand what needs to be done and where the emergency might lie. We do see more of that coming from just smartphone interactions with your provider. And then we're always looking at ways to kind of bring the cost down, make a intraoral camera that might be accessible to some patients to use, and use it across your family, use it for other purposes. But right now, we just see some patients who have invested a lot in their dental care or have issues, periodontal disease, post-surgical rehab. Those are patients who might want to invest, and a doctor might subsidize the camera for them. And get the camera out to them. We're drop shipping some cameras to patients right now, and they can use that. So in this video conference, I could add a stream from my intraoral camera, and now you've got a doctor who's really good. They're set up. They can see, they can navigate, they can ask all the questions, get the right images. And our system's nice in that it's set up so that not only could the doctor record all of those consultations so that they're protected later for audits and reviews and documentation, but they can also capture still images, which can then get put into kind of that patient's record, which could be shared with other providers, shared back to the patient, used for as a tool for education on home care, whatever it might be.
Interesting, interesting. So you said you didn't use these words, but you said your phone's been ringing off the hook in terms of applying this. I assume that that's from private practices, dentistry practices that want to roll this out versus individuals. If I was just a patient, if I had a tooth problem and I wanted to see a dentist, but my dentist didn't have teledentistry, what do I do?
You probably would want to call the office. I think right now HIPAA has been pretty intelligent about just loosening restrictions that might prevent a doctor from connecting with their patient.
Mm-hmm.
So we've talked to doctors who were using FaceTime to communicate with their patient, and now they're moving to a HIPAA solution with record keeping and all of the tools that we've built into it. But yeah, now according to Health and Human Services, while there is a HIPAA waiver on and removal of penalties during this time, there's still things practices need to look at on state level restrictions, and also they're not removed from potential liability if PHI was released. So we still think they should move toward a HIPAA compliant solution, but I think for patients at home with a concern, call their office. They should definitely talk to their office. We are working with private practices, with insurance carriers, with a range of touch points on the dental care delivery stream that ideally a patient would be able to say, look, I talked to this dentist. Maybe it was just sending pictures. And this is what people were doing for years, of using their phones. Johnny got knocked out at the Little League game, sending a picture to the dentist, but they're just texting it, or they're maybe calling and emailing it. So yeah, there's all kinds of ways. And I think doctors more than ever now are open to that. And while their offices are closed, and this is a key point for dentists, while they're all closed, the ADA and insurance companies have kind of provided some guidance, and more insurance companies are reimbursing for the exam part of their service. So you could do an exam and bill insurance or bill the patient for this virtual consultation that's taking place, which is great in that a practice, while they're completely closed, at least still has that ability to provide some service to their patients and generate some revenue stream. As small as it might be, it's something that can kind of keep their team engaged and keep the dentist in touch with their patients.
Yeah, you bring up a very important point. What are you seeing as the economic impact of this on the dentistry industry right now?
Your store is closed.
Yeah.
There is no access to your patients for any, services. We saw more states close it even for emergency.
Are you seeing a lot of closures?
We're seeing, like kind of furloughing of staff and closing of offices. I think there's probably around 40 states where you can at least still go in for an emergency appointment. So I think this is a tool that helps practices triage those emergencies. But for a state where you're fully closed, even for an emergency procedure, and they're trying to get infection control and negative air pressure settings for any treatment that's needed, you're completely closed. So the only path to revenue for you now is through a teledentistry approach.
Got it.
We want to make sure we're servicing the market, the industry now, becoming a resource for them, whether you're using teledent or you're using FaceTime. We want to help you understand best practices and what you need to know. But long term, there's going to be really this value that practices see of how does my practice change and how can I deliver better care when I incorporate teledentistry in addition to traditional dental care delivery.
Got it. You mentioned the term teledent a couple of times, but we never really talked about it. That's the name of your platform that you offer?
Yeah, so teledent is our teledentistry platform. It allows for provider to provider communication, provider to patient, patient to provider. It's basically a full-fledged HIPAA compliant turnkey teledentistry software platform.
Got it.
And then MouthWatch is our parent company. We also offer the intraoral cameras that we sell to practices. We sold them to them when they were open.
So to end on a positive note, one of the themes that we keep talking about at Startup Health is how this moment is offering this leapfrog opportunity, in that in a post-COVID world, a lot of the things that we're pushing on now are going to have these other downstream benefits. So what are you most excited about this surge in interest in telemedicine and teledentistry? What are you optimistic about that opening up post COVID-19?
Yeah, great question. I think there's going to be a pretty big reevaluation of the role dental care provides to patients. And what I think teledentistry can do is really incorporate oral health and dental care in a more convenient way into more aspects of a patient's life. So your provider can not only offer, the twice a year cleaning and exam and then restorative work, but they can help educate you on, a healthy lifestyle, on things you should know about for better home care, to emphasize, potentially less visits for restorative treatment, but easier access to dental expertise and oral care expertise. I think that's going to be a big part of it, that practices are going to start engaging with their patients and really showing, this big message that's been going for a long time of the mouth is connected to the body. Dentists are a doctor of the mouth. This is not a separate part of the health system, that if you have diabetes, you should be getting cleanings more frequently. If you're pregnant, you should be getting your periodontal health checked. If you're undergoing chemotherapy, you should be seeing your hygienist before you begin chemotherapy. So we see this all the time. And really, how does that medical setting connect to the dental setting for the convenience and healthcare of the patient,
Hmm.
right? If I'm going to see my OBGYN, can they refer me to the dentist and get enough information that the dentist can contact me and say, let's bring you in before, let's have a couple of cleanings to make sure you're in good health. If you're going through cancer treatment, we want to make sure you're connected with your provider, and that it's not, like I said earlier, it's not the redheaded stepchild. It's
Yeah.
really a way to say dentists are a part of the healthcare system, and it's integral to all of these different facets of your life. Teledentistry makes it a lot more convenient for you to communicate with your dentist, but also to integrate it with all of the other aspects of healthcare.
Yeah, yeah. The more integrated, the more connected it is, the more overlap you can have. I love that note to end on. Brant, thank you for the work that you're doing with MouthWatch. I really wish you the best for the company and your family there in New Jersey. And thanks for pressing on during this time.